Good evening. My name is Cameron Rock, and I'm the caseworker here at Sacred Place LLC. Here at Sacred Place, we work with youth and their families to promote wellness and recovery through holistic healing. I actually recently just came across something new that I hadn't seen before, and I wanted to take a second to kind of talk to y'all about it. So, Miss Simmons came to me about 2 weeks ago with some concerns regarding her son's Brody's behavior. Now, Miss Simmons is a single mother, and she defines Brody's behavior as above and beyond normal teenage disobedience, and it's something that she feels like she can no longer control. Now, Brody is a 15-year-old boy, so one would expect some some level of rebellion due to the developmental stages that we all must go through. Now, when I was first assigned the case, I was really curious to understand what her concerns were and what she thought was kind of out of the ordinary. When I sat with Miss Simmons and Brody, I quickly understood. She told me that he will not listen to anyone or anything. She said he's actually right now currently having a lot of trouble at school. One of her concerns is that Brody will not comply with any request or requirement at school from any of his teachers. She stated that he seems to disobey almost on purpose. Brody argues with his teachers or other staff about everything. He's also at times been observed in several classes intentionally doing things that get on his teacher's nerves. So kind of picking at everybody. She said that Brody seems angry quite often. His mom has actually had several conferences and mediations with the different staff and teachers at the school, and that didn't seem to help. At one point, Miss Simmons did have him tested just to kind of see what was going on academically, and she reported that his academic levels actually met or exceeded where he was supposed to be. She said, however, his grades are starting to be impacted due to the behaviors that he's exhibiting. Now, when I asked Ms. Simmons if there was a history of drug use, she reported that he has never even tried anything. So when I started looking at it, I realized, so Brody has a childhood disorder. When we look at childhood disorders, they can be externalizing or internalizing. Now, internalizing disorders would be things more like anxiety or depression, kind of things that are going on inside. Now, when we look at externalizing disorders, these are things like more outward behavior, outwardly directed things, so maybe like more aggression or non-compliance, things like that. Now, the specific disorder that Brody has is called oppositional defiant disorder, or ODD for short. Now, in some aspects, oppositional defiant disorder does resemble conduct disorder. Other than a diagnosis of oppositional defiant disorder comes when a child still exhibits certain behaviors of conduct disorder but does not have the extreme physical aggression. Now, some of the symptoms of oppositional defiant disorder are losing their temper, argumentative with adults, continuously refusing to comply with the requests from adults, deliberately doing things to annoy others, being angry, vindictive, spiteful. So as we previously discussed, you can see how Brody exhibits some of these symptoms, most of them, of oppositional defiant disorder. Now, with oppositional defiant disorder, it is something that is, if it's left untreated, it can get worse with age. And they actually did some studies where it's typically more prevalent and worse in boys than it is with girls. Oppositional defiant disorder causes problems in social settings with their behaviors because it impacts others and their peers. It can cause problems in learning. It can cause problems in society. So it can impact how someone interacts with society in general and how those interactions can impact learning or opportunities. So, and it can ultimately land them in jail or in legal trouble. Now, there is treatment options out there for oppositional defiant disorder. Some of those would be family interventions. So you have things like family check-ins, which consist of 3 meetings. Now, in those 3 meetings, the caseworker, the clinician, would get to know the family, assess the family, and provide feedback for the family, just to kind of help them with their parenting. Now, there's also parent management training. With the parent management training, it basically, when it boils down to, is reinforcing the positive behaviors. So the desired behaviors that we want to see, instead of like the antisocial behaviors or the behaviors that we want less of. And then we've also got multi-systemic treatment, which involves therapy for the community, the family, the school, and the peers. I think Ms. Simmons is on the right track. So she's made the first step into seeking help and coming and sitting down. I suggested that we continue to work together. And I also suggested that we use the parent management training and the multi-systemic approach. The reason I suggested that one is because there has been so much going on with the teachers that I think it would better serve Brody if everybody was on the same page.